Community health centers are as diverse as the people and areas they serve. Located in northern Michigan, the Alcona Health Centers are the sole comprehensive medical resource in Alcona County.
It's a little bit isolated in that respect, sometimes even as much or more so than some communities in the UP, for instance.
These are pretty small communities, and we're a pretty important provider of care for the community.
We have a large number of both nursing staff and docs who came from this area, went to high school here, and then came back here to practice. So to me, that kind of tells me that they're invested in the community too.
On the other end of the spectrum, community health centers also provide quality health care in more populated areas.
You have to recognize that the history of Detroit has a lot to do with the history of Michigan. Detroit is a part of what makes Michigan great.
Many people don't know that they don't have to have insurance in order to get health care.
Community health centers provide a very necessary service to the community, and it makes no difference which community. The patient comes first. That's what really this is all about.
In each community health center, teams work together to provide a core of primary health services to individuals and families throughout all stages of life, from pediatric through geriatric.
We're not just about, putting a Band-Aid on it. We're really here about empowering our patients and trying to help them develop a more meaningful life and help themselves.
This is extremely important in a primary care situation because primary care is the first stop.
As the needs of a patient go beyond primary care, community health centers are uniquely situated to provide access to specialists, both in-house and through relationships with other providers in the community.
I'd like to provide you with some information about nutrition for while you're pregnant.
If you just treat somebody that has diabetes, but you don't address the fact that maybe they have depression to go along with that, or life stressors going along with that, you're only treating a portion of it.
We have a very comprehensive group of professionals that have come together to provide care.
And most of the patients like the fact that they can get so many services in one place. I mean, there's not very many places you can go and see your doctor, see your dentist, see your therapist, get your medications, get your eyes checked, and you do everything in one clinic.
Prenatal care provided in a group format with the same cohort of women who are all due about the same time.
Not only are our moms being taken care of in terms of the pregnancy, but in terms of their total self.
That is truly one of the best parts about working in a community health center, is that you have all of those providers in one location.
They're right in the same building. Referrals can happen right away, sometimes even at the same time.
It really improves the quality of care, particularly for individuals that might have transportation issues, translation issues, where I can't just send them to any doctor because they might not be able to communicate what the problem is once we get them there.
Each health center goes to great lengths to ensure that it is accessible to as many in its community as possible. With transportation assistance, translation services, and extended hours available at most locations, it becomes easier for all users of health centers to access the care they need.
A lot of the patients that I've seen have had diabetes for quite some time, but never has anybody sat down with them, explained to them. So a lot of it is communicating, and it's good communication with them.
The resources of a community health center can bring about real change in a community. Over 99% of surveyed patients report that they are satisfied with the care they receive. Community health centers have been given the highest rating a federal program can receive for extending high-quality health care to underserved populations.
Good, how are you?
The health care that they provide is exceptional in any setting, not just a federally qualified health center, but in any setting.
All of the physicians in our facilities are all board certified.
We have very high standards as to the people we bring on board.
The mission is to serve everyone. The mission is to bring quality care. And the mission is that they work together at this.
The people that I work with are great, and in every aspect are patient advocates.
This is their role in life, that they want to deliver health care to those in need the most.
For the most part, as far as I have seen, the patients absolutely love them.
It's just been a great place to work. I think not only do we try to be sensitive to the patient's needs, we're good about being sensitive to our staff's needs.
The community environment of health centers is fostered by high retention rates of both providers and users.
It really does create somewhat of a family or team spirit.
I've been at the health center now for 15 years, and haven't been happier.
But it is a challenging position, very, very worthwhile. I love the people that I work with, and I love the patients that I help.
Each community health center works to interface with other institutions and individuals, contributing to its community in unique and meaningful ways.
It's my community. This is our home. I also know how far we have to go.
I'd grown up in this area and I wanted to come back home.
I love being back in the neighborhood where I grew up in and being able to work in an area where I can serve people that I grew up close to.
You have neighbors helping neighbors. You have people who speak your language providing care to you.
Patients are very connected to our healthcare centers. It's more than just a place where you get health care. It's a support network. And in our community, that's very important.
So from that perspective, I think it definitely helps in building relationships.
We work with the business sector, the religious faith community, the school districts, the public entities. Pretty much, unlikely partners pull them together and say, hey, what are we going to do?
Health centers employ thousands of people across the communities they serve. They bolster local business and stabilize neighborhoods by stimulating community development and economic growth. When users access care and invest in their local health center, they truly are investing in their community.
Decisions about how care is going to be given are made by local citizens.
In fact, 51% of our board have to use the health center, and then we really stick to that. I say minimum of 51%. It can be more.
It is a body of people chosen from the community that come together to help the administrative wing.
Because they're so unique and diverse, there is not a single perspective, and they struggle so heartfelt on real issues.
To be able to gauge what kinds of services that health center needs to structure, to be responsive, not just reactive, but proactive.
That has really opened my eyes quite a bit to some of the community needs and community resources and some of the people here that really do want to make a difference.
Each community health center represents an opportunity for providers and community members to connect and together invest in the health of their hometowns.
I think medicine has become so complex that you simply can't do it alone as an individual provider of care. You need a support system, and community health centers really provide that support system.
They go out of their way to make sure that you get the best of service.
My parents come here.
And my family recommends their friends.
My whole family now comes here, everybody.
We are just touching the top of the patient population. We have a long way to go.
Community health centers offer a cost-effective way to provide high-quality, comprehensive health care to all members of a community.
This is good. Thank you. Where do I think I'd be today? I'd be deeply in debt and far sicker than I am now. There's no question about it. So now I'm fully covered, but I still will not leave this place. I wouldn't leave here under any conditions.
Do you have a doctor that you go to regularly? Are you and your family healthy? Are you where you want to be? And, I have some really caring folks who want to partner with you.
Give us a call and come out and take a look. And there's nothing more valuable than spending a little bit of time and talking and watching.